You might not know the term trochanteric bursitis, but this is a fairly common condition that causes hip pain in military service members and veterans. In this video, I'll explain what it is and how it's treated. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. Now, bursitis, what that means is that's a swelling or inflammation of a bursa, a fluid-filled sac near a bony prominence in locations. There's some around the knee, some around the shoulder, some around the foot. And what a bursa does is it helps facilitate movement between tissues that move against each other. So when bursitis occurs, basically that inflammation causes that fluid-filled sac to fill with more fluid, and it can cause either pain with direct pressure against that bursa or with repetitive movements. And that can be really aggravating to anybody, let alone a veteran. Now, there's a lot of causes, whether it's overuse, whether that's infectious disease or trauma or inflammatory disorders. Now, specifically when it comes to the hip, trochanteric bursitis, this is a model showing the hip. You got the ball and socket joint, which you really can't see because of the ligaments surrounding the ball and socket, but you see this femur, the thigh bone, and that bony prominence there is your greater trochanter. You can feel it on the outside of your hip. And there's a fluid-filled sac over that greater trochanter called the trochanteric bursa, and it can get inflamed as the tendons that run on top of that bony prominence, basically the fluid-filled sacs between the two, to prevent friction. It's normally a very small fluid-filled sac, and it allows for those gluteus tendons to slide over that bony prominence with range of motion. Again, it's on the lateral side of the hip. So typically when you have pain on that bony prominence, that is related to trochanteric bursitis. Now, that trochanteric bursa, when it's inflamed, can be a very common cause of hip pain. And inflammation of that bursa usually is due to repetitive microtrauma, so things like running or exercise. Again, a lot of time why you see it in military service members. That bursitis can lead to a tendinopathy, either from a traumatic event like a fall from a height or compression of that bursa, but you can get inflammation really with no cause as well. Typically what you're going to experience is one-sided hip pain on the outside of your hip. People can usually localize the pain very specifically. They can point right to it and it'll be on that bony prominence, the greater trochanter. A younger active patient may report a history of repetitive demands, athletics, running, cycling, jumping sport. A doctor can diagnose this with physical exam. That's usually the gold standard. It doesn't usually show up on x-rays or MRIs. Again, just the physical exam showing where the tenderness is along that bony prominence. Diagnosis, again, is typically clinical. Sometime imaging like x-rays, that can be important, but more than anything, to rule out other causes of pain. Treatment is almost always non-surgical. Anti-inflammatory medications, physical therapy, stretching, sometimes cortisone shots into the bursa. That usually is good enough to get the pain to go away. Occasionally, though, surgery to go in and basically cut out, remove the trochanteric bursa can be helpful in cases that aren't getting better with non-surgical treatment. All right, if you have ideas for future videos for this channel, whether it's particulars about Nexus letters or DBQs or specifics on injuries or risk factors, leave those in the comments below. Make sure to subscribe to this channel, click the bell to be notified when I release a new video. If you're interested in a Nexus letter for your injury or condition, click the link in the description below this video to learn more about working with me and my team. We do everything we can to make the process as simple and as quick as we can for you, and I try to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to working with you.